Thank you, Lauren. Yeah, so my name is Dr. Rebecca Cannon. So I'm a specialty registrar in community sexual and reproductive health, but I'm working with public health at the council at the moment. And I'm going to be doing this webinar on the long-acting reversible contraception toolkit. Okay, so there's a little bit of background. So Lauren assures me that this has been gone over quite a few times. But what is this all about? So we know that any intervention needs to be measured for its impact and outcome. We need to be able to do this assessment to demonstrate that an intervention is making a difference and any measurement tool allows us to do this. So using a standardised tool means that we can also compare interventions against one another to look at how effective they are for different groups and look at their cost effectiveness, because obviously otherwise we can't say whether an intervention is helping or working or not. So the Birmingham Public Health Measurement Toolbox has been developed by Lauren and her team at Public Health at Birmingham City Council, and the idea is to standardise measurements for any health and wellbeing interventions in Birmingham. So the intention of this is to support different organisations that are developing projects or providing interventions, to help them for applying for funding and to see whether their interventions are making a difference. And obviously, if different organisations are all using the same tool, they can be easily compared against each other. So Lauren and her team are running a series of webinars. We're not going to talk about all of these topics today, but we're going to focus on the long-acting reversible contraception toolbox. And hopefully each of these webinars will help to give a little bit of background, explain how to use the tool and provide a little bit more information about this as well. If my slides move on, perfect. So we're talking about the long-acting reversible contraception toolkit today. So what is long-acting reversible contraception? So to save me speaking for so much, I'm going to call it LARC. So long-acting reversible contraception. So contraception, obviously any method to prevent fertility, so protect against unplanned pregnancy. Long-acting itself means something that's delivered less than once a cycle, so less than once a month. And obviously reversible means that once it's stopped, removed or run out, that there's no effect on fertility and there's potential to get pregnant again. LARCs are the most effective types of contraception, largely because you don't have to remember to take them so often, and they can last from a few months up to 10 years, depending on which option you choose. But they do need a trained doctor or nurse most of the time to administer or fit them. And really, when we're talking about in real terms, the term LARC encompasses the injection, so that's the hormone injection that's given once every 3 months, the implant, which is that blue rod in the middle there. So it's a small 4-centimetre white plastic rod that's popped under the skin of the upper arm, and that lasts for 3 years to prevent against pregnancy. And then the coils, so that's those T-shaped devices on the right that are fitted into the womb, and they last between 3 to 10 years. So why are we talking about LARC today? So we know that LARCs are the most effective types of contraception. They're very cost effective, and they're often really positively seen by people who use them. However, LARC rates in Birmingham are much lower than the national average. So when we're looking at the Public Health England fingertips data, if we're looking at LARC rates, especially those administered by sexual health services, Birmingham is actually right at the bottom compared to the national average and compared to other areas. Conversely, the rate of abortions is much higher than the national average. So obviously this suggests, that there's an increased rate of either unplanned or unwanted pregnancies. So this is suggesting perhaps a lack of awareness, lack of understanding, and maybe some barriers to uptake that need to be addressed. So what are the target groups? So looking at the data, really the groups that we would want to be promoting LARC2 are in sexually active women under the age of 25. And obviously, for ease, I'm using the term women, but I appreciate that not all women can get pregnant, and those who can get pregnant can also encompass non-binary people and trans men. And also those in specific communities that have been identified with increased inequalities. So that's Pakistani, Indian and Bangladeshi women, African and Caribbean women, and Central and Eastern European women. But really the tool can be used by anyone who's got the who's able to get pregnant and obviously doesn't want to get pregnant. So what are we aiming to measure in the tool? So we're trying to look at a particular intervention, and we want to measure the number of women who are using LARC before and after that intervention, or who have an awareness of LARC before and after that intervention. And as I kind of briefly said earlier, this obviously helps to evidence interventions that improve uptake, and see how those interventions are affecting results or LARC rates. So the tool's really easy and really quite straightforward. So it's just 4 questions. So the first one is, are you planning on becoming pregnant in the next year? Obviously this is important because if someone's planning for pregnancy or wants to be pregnant very quickly, that can affect whether it's suitable for them to be using a LARC or not, and it may not be something really that we need to continue with. Are you using contraception currently? What form of contraception are you currently using? And then a list there of kind of the most common forms of contraception. So the pill, the patch, the ring, condoms, male and female sterilisation. So that's vasectomy in males, or having your tubes tied in females. And then also the LARCs are in there. So the injections, the coils and the implant. And then have you heard about long-acting reversible contraception being the last question. So using the tools. So the tool can be used for women within target groups or any women of reproductive age. And really it's about kind of starting those discussions and doing a brief assessment about LARC and also contraception. Obviously, when we're talking about contraception, it can be a little bit difficult to other areas of health and well-being. So we need to use it in a sensitive way and, you know, make sure someone's consenting to discussing contraception. So whether that's, we've got a brief questionnaire about contraception, are you happy to take part? Or even more simply, just do you want to discuss contraception today? Can be really easy ways to just open up that discussion. And as we know, so conversations about contraception should be confidential, and any organisation that's discussing confidential information or things like contraception should be able to provide an explanation of what that means to the patient, and people who are using the tool or having those discussions should be appropriately trained. And the tool should obviously be used in a private setting, so it can be very personal for some people. There can be lots of it's very multifactorial decision contraception, so it needs to be that service users are on their own, they feel that they're in a safe space, they can't be overheard by others when having this discussion, and obviously interpreting, translating services used where appropriate. So specific things to consider. So we need to remember that contraceptive use is not always the individual's sole decision or responsibility. So there are lots of factors that can be involved in contraception. And also, you know, when we're having these discussions, it may be that it could be uncovered things about safeguarding or worries about abuse or violence or coercion. So really anyone who's using this tool or having those discussions needs to be able to, you know, if they find information like that, know what to do with it and have appropriate procedures and pathways in place. The other thing is, obviously, we want to improve LARC rates in Birmingham, and that's kind of the whole point of this tool and the whole point of any intervention. But that is amongst people who want LARC, so it's not for everyone. And we need to be able to, you know, provide a non-judgmental environment where if someone doesn't want to discuss contraception at all, then that's fine. If someone says that they don't want to get pregnant, but they still don't want contraception, that's also fine. And if someone just doesn't want to engage with the discussion, there should be no judgment. It shouldn't affect any other aspect of care or the service that we're providing. So for example, so where could this tool be used? So a tool is kind of intended for any voluntary or community sector organisation who works with women of reproductive age and feels that they either have the opportunity to or already are discussing contraception, and hopefully the tool can sort of provide them with that support to discuss contraception at a contact, and also allow them to be able to measure, are these discussions or is this intervention actually meaning that more people are aware of LARC or more people are using LARC, and then with the potential for, remuneration of that service as well. So I've just put here, so a link to the data, so the public health profile, so that's the fingertips data with regards to LARC rates across the country, and then some really good information about contraception as well. Obviously, every service is different. We don't know about, the provider's level of knowledge, and, if you do start a conversation about contraception, it may be varied about where you go from there, whether it's just signposting to services, but obviously a really good step is signposting to information. There's a lot of not so great information out there on the internet, so anything with the NHS stamp on it or anything on here is really good, with really good infographics for patients as well. And just when we're thinking about our target populations, Sandyford in Scotland have really good information on contraception in other languages as well, so that can be a helpful resource. Okay, so that's kind of the end of my presentation, the end of the discussion of the tool. So let